All right, we're going to go ahead and get started. Good evening, everyone, and thank you for joining the Labor Campaign for Single Payer tonight for this very important webinar entitled Medicare Advantage and the Privatization of Healthcare, What Unions Need to Know. My name is Roach, and I am the National Coordinator for the Labor Campaign for Single Payer. Before we begin this webinar, I wanted to take a moment to say how heartbroken and outraged we are by the horrific act of violence that took the lives of Minnesota State House Speaker Emeritus Melissa Hortman and her husband, and injured Senator John Hoffman and his wife Yvette this past Saturday. As a Minnesotan, I have had the honor of working with both Speaker Hortman and Senator Hoffman, and can assure you that they have always been unwavering champions for workers' rights, for labor, and for healthcare justice. Their commitment to equity, dignity, and public service left an indelible mark on our state. There is no place for violence or intimidation in a democratic society. No elected official should fear for their safety while working on behalf of the people that they represent. May we all stand in solidarity and continued commitment to the values that they carried forward: compassion, justice, and care for all. The reason the Labor Campaign for Single Payer is sponsoring tonight's webinar is because our public Medicare program is at risk. It is rapidly becoming an endangered species right under our noses. And the vehicle being used for that privatization is known as Medicare Advantage. Privatization of traditional public Medicare isn't good for us as patients, as workers, as healthcare providers, and it isn't good for our economy, as precious public healthcare dollars are diverted to corporate stock buybacks, shareholder dividends, and exorbitant CEO compensation packages instead of healthcare for patients. Tonight, we'll hear about labor's connection to the passage of Medicare and Medicaid, what elected congressional representatives are seeing and working on to protect public Medicare, learn about the very real impact of this privatization and its effect on health disparities, particularly racial health disparities, and hear from a couple workers who've had to deal with the obstacles put into place by corporate advantage plans and the very real harm that was done to human beings when they can't easily access the care that they need because corporate healthcare puts profits over patients. We plan to hopefully include some time for Q&A, and we will have a few asks of each of you at the end. We are recording, so we will make sure you get the link for follow-up as well. So as we begin, I want to be sure also to thank our partners in the fight against Medicare privatization, including a number of national and international unions, as well as numerous community organizations who have come together to form the Reclaim Medicare Coalescence, of which the Labor Campaign is part of. I am thrilled and honored to begin tonight's program by introducing my sister in the struggle, the incredible labor leader, Sara Nelson. Sara is the International President of the Association of Flight Attendants Communication Workers of America. A flight attendant since 1996, President Nelson was elected AFA-CWA's International President in 2014. President Nelson also serves as an Executive Vice President of the National AFL-CIO. President Nelson is wicked smart, a focused strategic planner, and a fearless union leader who fights not only against the corporate bosses her and her members face, but the corporate bosses that we all encounter, including those that are controlling our healthcare system. President Nelson, welcome.
Rose, thank you so much. And I just want to say a special thank you to you. You've dedicated your life to caring for people, not only as a nurse yourself, leading your union, and making sure that workers actually have a voice in the workplace so that we can call out the injustices that are happening right there. Typically, when we are trying to make good products or we're trying to care for people, we're trying to keep services moving, we know our work best. And it's really important that we have strong unions in all of our workplaces to make sure that not only workers are protected, but also consumers and everyone in our communities. And I want to also just call out the fact that you started off with a call to all of us to think about Melissa and Mark Hortman and their memory and their service to all of us. And that this is a time of crisis, but in a time of crisis, is when we also have the opportunity to be at our best and to lead forward as a labor movement. Our labor movement is built on the idea that an injury to one is an injury to all. Our Medicare system and healthcare system in this country, and the idea that we have healthcare actually connected to our employment as well, was really founded by the idea that we should all have healthcare, that we should have healthcare as a human right. I think it's really important to recognize that it was unions that were conducting general strikes that made it possible for the New Deal, gave FDR the power to sign the New Deal into place, that gave us basic workplace safety protections, the minimum wage, wage and hour protections, Social Security, that gave us the basic social contract, including the ability to join a union. And it was that same power that drove FDR to say that that work is unfinished until we actually have an economic Bill of Rights that includes a decent home, a living wage, a good job, and healthcare as a human right. The ability to have an education without a death sentence, and the ability to have care in the event of disability, old age, or anything else. We have to make good on that promise. Walter Reuther brought that forward to the big three after he had formed the mighty UAW and said to them, let's go together, companies and unions, to Washington and put in place healthcare and pensions for all. And they turned around to him and said, that sounds like socialism, so we're not going to do that. And he said, that's fine. I'll see you on the picket line and we'll take it from you. So that first step in getting into our union contracts and setting that standard that there is employer-sponsored healthcare plans it came from the UAW with the vision that we would all have healthcare. I think about our efforts to make sure that we fought for domestic partner benefits for all of our LGBTQI siblings in our union. And that fight continued on and continues on still. But our fight for that in our contract led us to testify in the San Francisco city hearings that led to the first ordinances for those domestic partner benefits that put us on the road to marriage equality and many of the rights for our LGBTQ siblings all throughout our unions and all of us, building up these rights for all of us. This is unfinished business that we started by negotiating in our union contracts. But what we need to do is stick together as unionists and finish the job to make sure that healthcare is a human right, to make sure that employers cannot hold this over striking workers' heads who are building up the standards of good jobs for their communities, good jobs that pay the taxes, that support our public services that we all count on. It's all related. And so as unionists, we have to finish the job and the vision that we have had for over almost 100 years now, that healthcare should be something that we all are bargaining together through a single payer system. And I want to call out the real strategic efforts, Rose, by the single payer campaign that is recognizing that we can all make sure that there is a public option where we can all bargain together and we are not actually competing to the lowest standards, which is what happens in a for-profit system and these corporate sponsored plans, but actually that we are demanding that there is a system that holds up one standard for everyone, which gives us greater bargaining power, make sure that we're leaving no one behind. And I think also to all the union members out there who have taken the gut-wrenching calls from members who are going through crisis in their own lives, we know that we have a job to do together. I know that as president of the Association of Flight Attendants, that I can't really do my job representing flight attendants without reaching out to all other workers to build the power that is necessary to take on capitalism that only considers profits, does not consider human beings. We are that check on corporate greed, and we have to be the check on ourselves and our own strategic actions to fight for single payer healthcare so that everyone has the opportunity to be provided with that healthcare that we need. And so, Rose, I'm so excited to be here with all of you tonight. I'm excited to advance this idea in every single way that we actually have the power, that the billionaires may have the money and they may be in control right now. But when we set the agenda, just like we did in COVID, I do want to just tell a very short story about what our union did. We recognized that in the airline industry, we were 80% organized. And in that moment of crisis, we put forward a plan for a payroll support program where any money that would go to the airlines would not just be given to the CEOs to decide how to use that and to use the ideas of trickle-down economics that we know is completely broken and an absurd notion, but that actually building our economy from the ground up is the better way to do that and the more effective way to do that. We put forward this plan that kept people in their jobs, connected to their healthcare, because that is the system that we have in place today, but continuing to pay state and local taxes that supported our communities, kept us in our credentials, and put a check on corporate greed, banned stock buybacks, and capped executive compensation. We were able to achieve that. We put forward that plan on a Friday, and by Wednesday morning, it was approved by Congress and signed very shortly after that by the president. That was in a moment of crisis where within a $2 trillion deal that got through Congress in that moment of crisis, we were able to actually put together a plan that was a workers' first plan. This is the agenda that we can set together. And in this moment of crisis in our country, I know that we are all concerned about where we are tonight. But this is also an opportunity for all of us to come together and not hunker down and protect what we have so that it continues to shrink. We can actually come together and express our power and set an agenda right now in this moment of crisis that finally achieves the vision that FDR, Walter Reuther, and many of us who have dreamed of healthcare as a human right can achieve together. So, Rose, thank you so much for the invitation. I know this is going to be an incredibly energizing and factually filled evening, and let's get to it.
Incredible. Thank you so much, Sara, for your inspiring words. You are spot on about bread and butter issues in this political moment are critical. We are incredibly lucky to have you as a labor leader in this country. Thank you for being here tonight. Senator Elizabeth Warren from the great state of Massachusetts was unable to join us in person tonight, but graciously provided us with pre-recorded remarks. Senator Warren is a vocal critic of the Medicare Advantage program, raising concerns about its cost, quality of care, and the potential for fraud and abuse, including overpayments, denials of care, and deceptive marketing practices. Also unable to join us this evening in person, but equally important as an inside the Capitol ally, is Representative Pramila Jayapal, who hails from Washington State. Representative Jayapal is the lead author of the Medicare for All Act of 2025. A true health justice champion, Representative Jayapal has been a staunch supporter of an improved and expanded Medicare for All system for many years and is focused on ensuring that Medicare does not become yet another privatized healthcare system. Often referring to Medicare Advantage as Medicare Disadvantage, Representative Jayapal has actively called for reforms to the privatized program to address issues such as overpayments, waste, and fraud. She has led efforts to urge both the Trump and the Biden administrations to enact reforms. So, Eric, if you could go ahead and please play the videos.
Hello, and thank you for the opportunity to join you for today's webinar. I'm here today because our healthcare system is broken. Far too many families are one medical emergency away from ruin. And attempts to privatize our health programs threaten to make the situation even worse. You've probably heard of Medicare Advantage, those endless ads on television promising extra benefits like dental coverage. Well, they may even throw in a gym membership, anything to get you to leave your real Medicare. Even their name is misleading. Medicare Advantage isn't part of Medicare at all, and certainly not an advantage. So what is it? Well, it's privatized Medicare. And unlike traditional Medicare, these plans are run by giant corporations whose priority is not you, not your family, but their shareholders. So what does that look like in practice? Well, the second you need to see a specialist, or God forbid, need surgery, Medicare Advantage plans limit the doctors you can see. They make you jump through extra hoops, or they just drag their feet or even deny the care that Medicare is supposed to cover. They'll cut short your hospital stay or try to kick grandma out of the nursing home early just to save a penny, all while charging top dollar. It is a trap. But I believe that every single person is guaranteed high quality health care. And that is why I am proud to support Medicare for All, a system that will make sure that everyone is covered. Nobody goes broke because of a medical bill. And we can finally stop fighting with the insurance companies. And for union workers, it would mean you don't need to rely on your employer for good health care. That means more leverage so we can fight for better wages and a safer workplace. But the giant insurance companies that are profiting off Medicare Advantage are threatening that future. And unless we come together and raise our voices, these companies are going to scoop up more and more people and amass more and more power until they are the only option. So that's why I'm fighting for a healthcare system that puts people over profits. But I can't do it alone. And there's no one I'd rather fight alongside than all of you.
Much gratitude to Senator Warren for her strong commitment to this issue and her continued fight against the privatization of Medicare. I think we are now going to hear from Representative Jayapal.
I'm Congresswoman Pramila Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives. Thank you to the Labor Campaign for Single Payer for inviting me to share a few words with you today. As many of you know, I'm proud to lead the movement for Medicare for All in Congress. My Medicare for All Act is the country's most comprehensive plan to transition to a single-payer universal healthcare system that finally puts people over profits. It is the only bill in Congress that outlines exactly how we would get to quality, affordable healthcare, that expands and improves Medicare to cover mental, reproductive, dental, hearing, and vision care, as well as long-term care. Medicare for All would finally put patients over profits, creating a healthcare system where everyone is in and nobody is out, with healthcare when you need it, where you need it, from the day you're born till the day you die. But as we fight forward for the healthcare system we need, we also have to fight back against the constant attacks from Trump and Republicans on the very healthcare system that currently exists. I'm talking about Trump and Republicans' efforts to privatize Medicare. Medicare is a critical piece of our healthcare system, and it's one of the few pieces that actually works. It provides care and services to more than 66 million Americans every single day. But Republicans want to dismantle the program and hand it over to private insurance companies who only care about profits. Privatizing Medicare is a terrible idea, period, and it's one that I will fight tooth and nail against. The most prominent form of privatization is Medicare Advantage, or as I like to call it, Medicare Disadvantage. These Medicare Disadvantage programs take shortcuts. They too often lead to worse outcomes and higher costs. They are profit-driven entities that encroach on Medicare and use the Medicare name and our entire healthcare system just to make money off of both patients and the federal government. We can and have to do better. We got to do better than inappropriate delays and denials of care, unnecessary red tape that slows down the ability of providers to offer critical services. That's why I've made it my mission to call out these plans as the scams they really are. They use deceptive advertising, such as upfront discounts with $0 premiums, but way too often people end up with worse benefits and outcomes for higher costs once you're trapped. Last year, a person in our district called my office not knowing what to do. She was one of those people that was trapped in a terrible Medicare Disadvantage plan. For almost 2 months, despite numerous calls and emails, she could not get off the plan and back to traditional Medicare and the benefits she needed. With my casework team assistance, my constituent was able to get off the Medicare Disadvantage plan, but Aetna reinstated her coverage effective the wrong date, meaning that she would have a lapse in coverage. We got in contact with the Centers for Medicare and Medicaid Services, CMS, who reached out to Aetna to directly fix this error. I've just seen far too many seniors run into problems like these, which is why I've repeatedly called on CMS to enact urgent reforms to the Medicare Disadvantage plans. Just a few months ago, I led 74 lawmakers in urging the administration to crack down on these schemes and reinvest in traditional Medicare. That was just one of many letters I've sent to CMS, urging them to eliminate the barriers to care that are caused by Medicare Disadvantage plan policies and to stop overpayments to these groups, and then take the savings of time and money from that and reinvest it into care for Medicare beneficiaries. We can't keep letting these private insurance-run plans overcharge for care and rip off patients and waste taxpayer dollars. Our seniors deserve better, and that's why I'm fighting to expand traditional Medicare to include dental, vision, and hearing, to stop the privatization of Medicare through Medicare Disadvantage, and to lower the age of Medicare eligibility so more seniors can access affordable quality health care. I'm not going to lie, we are going to need you in full force right now because the Trump administration has other plans. They want to fully privatize Medicare. They want to allow private health insurance companies to completely take over the system so that they can continue to deny your ability to access health care. Trump intends to increase profits for giant CEOs and make you pay more for it out of your own pocket. He intends to stop you from seeing the doctor of your choice, to delay your critical care, and to sue you when you try to resist. So I promise you, we're going to fight this, and we simply cannot do it without you, without our movement. We can't end up with Medicare Disadvantage for all. We need Medicare for all, and we need your organizing, your mobilizing, and your collective power to fight back against the giant insurance companies that are trying to buy up and destroy the vital public programs that we rely on. Unions shouldn't have to negotiate for healthcare at the bargaining table. Healthcare coverage should be a universal right guaranteed to everyone. And when you're negotiating healthcare at the bargaining table, it also means you're taking away from the ability to raise wages for all workers. So let's continue building our movement, educating our friends, family, and the public about these Medicare Disadvantage plans. Let's continue rallying, making phone calls, and sharing stories about how Trump and billionaires are ripping off working people. Let's save and expand Medicare to make life better for millions of Americans. Thank you all so much for having me today. And please know that as you continue this fight, I'm going to be right there alongside you every step of the way.
Awesome. Thank you, Representative Jayapal. You know, in dealing with this rapid privatization, we must have an inside-outside strategy, and having Senator Warren and Representative Jayapal working so hard against these profiteers inside is critically important to our work. And now I want to take a few minutes here to provide an overview from a worker labor perspective on just what Medicare Advantage is, what it isn't, and why labor must join the fight to protect and improve improve traditional Medicare. So let's see if technology is going to be my friend and you're going to see my slide. I want to note two things before I jump into this presentation. First, it's not meant to shame or blame anyone. We know that many retirees and and a number of unions are participating in Medicare Advantage plans. It's understandable considering how costly our healthcare system is overall. But it's important to know that when it comes to Medicare Advantage, as has been said, it is not Medicare and it's not always an advantage. Medicare Advantage is the misleading name that is given to the corporatized portion of Medicare, the portion in which tax dollars are funneled through private insurance companies to provide enrollees a private insurance plan. And the second thing I want to mention is that members of both major political parties have contributed to the privatization of Medicare. And quite frankly, to all of our public health programs. That's why, regardless of political party or ideology, when it comes to healthcare, it's in all of our best interest to work together to secure public health by promoting public health plans. When we look at one of the great social safety net programs ever enacted, Medicare, we can see from these headlines that the healthcare marketplace is now entrenched in our Medicare program. I mean, here's a few of them. How health insurers racked up billions in extra payments from Medicare Advantage. United Health Group is under criminal investigation for possible Medicare fraud. 1 million+ patients lose coverage as insurers and hospitals drop Medicare Advantage. And then we have this. This really is the consummate headline. Goldman Sachs asks in biotech research report, is curing patients a sustainable business model? Well, I thought curing patients is what the system is supposed to be all about. And if it isn't focused on that, we got big trouble. So the system over the past probably half a century has really been focused on like incremental market-driven tweaks that have failed miserably. Yet these failed strategies continue to dominate the healthcare reform debate. These market-driven reforms are known to us as managed care. However, they don't manage our care. They manage money. It is our healthcare professionals who manage our care. Many healthcare economists hold to this idea that excessive healthcare costs in the United States are due to two things: physician greed and patients getting too much care. Neither of those two diagnoses are correct, and there isn't any evidence saying otherwise, to say nothing of how incredibly insulting that is to our care providers. There is, however, mountains of evidence that demonstrate the exact opposite, that managed care schemes have increased cost, done little to nothing to improve quality, and have exacerbated health disparities while driving extreme market consolidation. You can't use market forces to control healthcare prices because healthcare isn't a consumable good. It doesn't operate under the theory of supply and demand. What's driving costs? To quote the late Uwe Reinhardt, a Princeton economics professor, it's the prices, stupid. And that's literally the name of an article you can Google and read about that Uwe wrote. And just to be clear, a significant part of that price includes unnecessary administrative costs. In terms of the workforce, that translates into a 4,000% increase in administrators in our system and only about 100% increase in physicians that are entering the healthcare field. That's upside down in a big way and a major cost driver within the system. And this is what market consolidation looks like. And thanks to managed care ideology, here's where we're at. Consolidation and merger frenzy within healthcare increases prices. It doesn't decrease them. 7 large corporations pretty much control all aspects of healthcare, except, of course, for actually providing the care. That market consolidation is also causing healthcare deserts because healthcare corporations are making decisions about where to open or close healthcare facilities based on their bottom line, not on the community's healthcare needs. Rural healthcare is particularly affected by healthcare corporatization and merger mania as we see continual closures of rural hospitals and reduced services. We must get back to hospitals serving as true community assets. The high cost of healthcare, retiree benefits being a permissive and not a mandatory subject of bargaining, coupled with absurd accounting principles. You may have all heard of these, GASB for the public sector and FASB for the private sector, have converged to put unions between a rock and a hard place when it comes to negotiating for retiree health benefits. Because early retirees, generally 55 to Medicare eligibility, are expensive to treat, we use more healthcare as we get older, employers are consistently trying to find ways to get out from underneath the obligation to provide this insurance. While pension benefits are generally vested for employees at a certain point, health and welfare benefits for retirees generally are not. Where there is not a clear contract language provision providing for vesting, courts usually place the burden on the employees or the retirees to show that the vesting of retiree health benefits was actually intended. This is wreaking havoc for retirees across this country. And corporate advantage plans within Medicare then becomes a tool that is used to divide and conquer us, pitting worker against worker. The healthcare landscape has set up the environment that is now causing the privatization of Medicare. I want to remind everyone that when Medicare was enacted back in 1965, the reason LBJ started with those over 65 and disabled is because insurance companies didn't want to insure the old and the sick. Seems over the past half of a century, they've had a change of heart. Willie Sutton, a bank robber from the gangster era of the early 1900s, was once asked, "Why do you rob banks?" And he responded, "It's because that's where the money is." Well, Medicare is where the money is. Of course, Medicare isn't perfect. It has its flaws, but never forget that Medicare desegregated hospitals has far fewer barriers to care than the private plans do, operates much more efficiently, and is more cost effective than privatized Advantage plans. We have seen many statements like this one from Kaiser Family Foundation and others, consistently describing the failure of corporate advantage plans to save money. But in fact, they are only increasing the cost of health care within our Medicare program. This is going to give you a sense of how advantage plans operate within the Medicare system. Oops, I'm sorry about that. There we go. These private insurers are making the decisions on your access to care. They are the middlemen between you and your provider. That means access to care is made more difficult as insurers institute barriers to care like narrow networks. 11.7 million Advantage patients are in networks that exclude 70% of the physicians in their county. And prior authorizations are another barrier to care, as is the for-profit tactic of cherry-picking healthy seniors while lemon-dropping sicker seniors to avoid spending money on their care. And high administrative costs, which includes profits, results in 35% more in funding to advantage plans that would be the cost, 35% more in funding to these advantage plans than what would be the cost in traditional Medicare. In fact, the American Economics Association looked at healthcare spending, and actually realized that the reality is that these Medicare Advantage insurer revenues are 30% higher than their healthcare spending. The private health insurance industry now receives more money from tax dollars than they do from the commercial marketplace. Here's how they overbill to receive overpayments. They make us appear sicker than we are to increase their payment rate from Medicare. They advertise to and grab onto the healthiest. As I said, they cherry pick. They receive quality bonuses that have no clear value for patients, and paying them as if they are providing lots of care based on how sick they made us out to be, while setting up barriers for us when we actually need the care for the sickness they're claiming we have. That means that we're overpaying them between $124 and $140 billion a year. And those overpayments are not being used for enrollee care. And this business model, allowing for these overpayments that are used for these stock buybacks and shareholder dividends and CEO compensation, is all being subsidized by us, the working class. Advantage premiums can be low and they can offer a few additional benefits because we're subsidizing this private program to the tune of billions of dollars a year. Prior authorizations within these Advantage plans is running rampant, causing delays and in some cases causing outright denials of care. Within corporate Advantage plans, death rates double after some cancer surgeries. 7.3 million people are left underinsured in Advantage plans, and up to 20 million hours a year are wasted because care providers have to fight with insurance companies to get their patients the treatment they need. This is all interconnected in a way that harms patients. Bottom line, corporate Advantage plans are not only wasting money, they deny care, and they undermine the idea of equitable single-tier care for all of the enrollees. So the ultimate solution to this convoluted mess is to begin building our public health infrastructure so as to create the conditions necessary and be ready when we can move to implement an improved and expanded Medicare for All system. How is any of this good for the working class? How is it good for public health? We do not need this complexity. We can and must move to this, a streamlined payment system that is publicly financed, privately delivered, and in doing so, workers can halt wage stagnation caused by trying to fund a system that has no rhyme or reason to how it is being financed. As we work to build that system, the immediate solution to the Medicare privatization program is to level the playing field between Advantage plans and traditional Medicare. We take back those overpayments and we limit traditional Medicare's out-of-pocket costs. We add pharmacy, dental, hearing, and optical benefits. Doing so makes better use of the taxpayer dollars by improving traditional Medicare. So what's the cost of doing all of that, you may say, of leveling the playing field? Well, remember when I said the estimate of how much these corporate plans are being overpaid ranges on a low side of $83 billion to a high side of $140 billion dollars. When I say we can recapture that money and redirect it to improve and expand traditional Medicare, you can see here that we could do that for $85 billion, meaning we would put into place a $5,000 maximum out-of-pocket cap, so the gap insurance may not be as necessary. And we could add pharmacy, health, dental, and optical at the Medicare Advantage level, which, by the way, isn't the best, and $5,000 out of pocket's too much. We'd like to see it lower, but in here, we're comparing apples to apples. This is what most of the Medicare Advantage plans have. So what if Medicare itself had the same? You can see here that without a doubt, we could do this, and we don't have to add more money to the system. We just use the money that's there that isn't going to healthcare, and I don't know, spend it for actual healthcare. Many unions and retirees find themselves in the position of having to consider corporate Advantage HMO plans. It's understandable, as I said, because the system itself is unaffordable. Our healthcare system, as structured, is failing all of us, which is why it's important to know that these corporate plans are facilitating the complete privatization and depletion of our Medicare program and funds. As such, the Labor Campaign has a brand new briefing paper, Medicare Advantage, What Union Leaders Need to Know. It's a comprehensive report that looks at this issue from a labor worker perspective and even offers resources and negotiations guidance when Advantage HMO plans are on the table for your union's retirees. In addition to the briefing paper, the Labor Campaign, working with the Puget Sound Advocates for Retirement Action, have drafted a sample resolution that we hope unions across the country will adopt, making it clear that labor wants to see the playing field leveled when it comes to corporate Advantage plans and traditional Medicare. We want traditional Medicare to be a true financial option for retirees and unions. The Washington, Minnesota, and Maine state federations have all adopted this resolution, and we're asking asking you to have your union do the same and help us get the resolution passed at your state AFL-CIO Federation. You'll find the resolution is on the Labor Campaign website under the tab for resources. Medicare is our program. Labor worked with the civil rights movement to get it enacted. We must now work to protect, improve, and expand it. We are the Labor Campaign for Single Payer, so no one should be confused about our position on healthcare. We support taking healthcare off the bargaining table by enacting an improved Medicare for all. Healthcare is at the heart of almost every battle unions face today. Many contract disputes are connected to health insurance and its ever-rising cost. Negotiations with the boss are the same for all of us. We are the only country in the world that links healthcare to employment. You lose your job, you lose your healthcare. And the bosses bludgeon us with this benefit when it comes to exercising our right to go on strike, because once you're off the payroll, you're off the employer's health insurance plan. It is time for labor to call the question. Is healthcare really something to be negotiated? Is it a benefit or is it a necessity? We can't win this at the bargaining table any longer. Our access to healthcare has become a weapon in the class warfare that we're all engaged in. And it is also the greatest transfer of our wealth as workers to the corporate bosses. Our job as trade unionists is to make healthcare for all politically possible by moving from resolutionary politics to revolutionary politics, from transactional representation to transformational change. Labor is uniquely positioned to help lead the way on coordinated campaign to fight privatization, to protect and expand traditional Medicare care while creating the conditions necessary to win Medicare for all. The labor movement has always been at the forefront of social justice change for all workers, and this is no different. It is our moral imperative to fight against this evil privatization and fight for real health justice for all. And you know why? Because protecting Medicare and fighting for Medicare for all is the ultimate act of solidarity. I want to you rest assured you are going to be able to get these slides and be able to access all of this and see this, because I know I had to go through that rather quickly. So I hope that was helpful in laying out some of the basics of where we're at and what we're thinking about Medicare Advantage. And now I am extremely excited to introduce our next presenter. Dr. Belinda McIntosh is a board member of Physicians for a National Health Program, a longtime ally and partner of the Labor Campaign for Single Payer. Dr. McIntosh is also the former co-chair of the steering committee of Georgians for a Universal Health Program. Dr. McIntosh is an assistant professor of psychiatry at Emory University School of Medicine, who works primarily at Grady Memorial Hospital in downtown Atlanta. Dr. McIntyre will be presenting on health disparities, particularly racial health disparities, and how corporate advantage plans are increasing and not decreasing those disparities. Dr. McIntosh.
Thank you, Rose. I'm going to take a moment to just share my screen. Really appreciate the introduction, and I am just so honored to be here with you all today. This is just an incredible panel of such amazing leaders, and I'll just jump right in. Thanks to the work of the truth tellers like Rose and Sara on this panel, in this audience and elsewhere, the Medicare Advantage secret is out. Medicare Advantage companies have come under intense scrutiny as investigation after investigation have revealed how they've rigged the system to get paid more while maximizing their profits and providing less care to patients. Now faced with irrefutable evidence of their corrupt practices and public outcries against insurance company tactics that hurt patients by denying and delaying care, the insurance company's latest response is to justify their disaster of a system by claiming that Medicare Advantage reduces inequities in our healthcare system. I'm here tonight to tell you that this is false. And I'll show you how Medicare Advantage not only perpetuates existing inequities in our healthcare system, but in many cases worsens them. And I'm going to show you some slides with data, but first I'm going to start with a story. So I'm a psychiatrist, and as Rose said, I work in the outpatient behavioral health clinic of a large safety net hospital in downtown Atlanta. And many of my patients have severe and persistent mental illnesses. Some are disabled, and among those, some are covered by Medicare. Now, one of my patients, Doris, is an African American woman in her early 60s, and she developed symptoms of schizophrenia while she was in college, and she was in and out of psychiatric hospitals throughout her 20s and 30s. Finally, after multiple hospitalizations, she achieved stability in her 40s when she was started on a new medicine that was only available in a specialty clinic because it required regular blood work and other monitoring. And Doris has been going to appointments in this clinic in the same system where I currently work for almost 20 years. For most of that time, her visits were covered by her traditional Medicare plan, which she qualified for based on her disability. And until recently, she received all her treatments, including her medications, group therapy, individual therapy, and psychiatric visits with no copayment or coinsurance. And all that changed after she saw an ad like this one. A few weeks ago, when I met with Doris for her appointment, she was in distress. She told me that she wasn't doing well because she'd received a bill from the hospital system for thousands of dollars. She was stressed, anxious, and worried about the bills. She had muscle tension in her forehead. She wasn't sleeping well at night, and she worried that the stress would cause increases in her heart rate and blood pressure, which we monitor very closely in that clinic because of the medication she's taking. And she explained that she had changed her insurance from traditional Medicare to a Medicare Advantage plan because she really needed some dental work and saw that the Medicare Advantage plan offered a dental benefit. Little did she know that by switching to Medicare Advantage, her out-of-pocket costs would skyrocket, and she'd end up unable to afford the routine psychiatric care that had kept her well for decades. Countless other people like Doris have seen these ads. They advertise these supplemental benefits that are available to you if you just sign up for a Medicare Advantage plan. But her story, but I'll tell you more about how that goes. Doris is not my patient's real name, but her story is very real and it's increasingly common. And she gave me permission to share her story so others can learn about the dangers of Medicare Advantage. Now, Physicians for a National Health Program has been blowing the whistle on the harms of Medicare Advantage for a long time. And we've had conversations with multiple members of Congress and their staff, telling them all about the things that Rose and everyone has just discussed. But Congress is also hearing a very different story. And when we talk with legislators about Medicare Advantage, the most common response we hear is that they're also hearing from the insurance industry lobby group AHIP, formerly known as America's Health Insurance Plans. And the industry lobbyists want us to believe that Medicare Advantage plans are a solution to healthcare inequities. And that's simply not true. Well, let's look at how industry groups like AHIP are claiming to be the solution to healthcare inequities. AHIP says that Medicare Advantage is a vital source of coverage for low-income and diverse populations. Well, that part's true, as this data shows you. A larger percentage of Black enrollees chose Medicare Advantage over traditional Medicare in 2024. But AHIP is wrong when it tries to use this as proof that Medicare Advantage is the solution to health inequities. That's completely backwards. In fact, the higher rates of Black, Hispanic, and low-income Americans signing up for Medicare Advantage isn't a solution. It's just evidence of the same problem that AHIP is saying it addresses. What it really means is that people from the usual disenfranchised groups are being left with no choice but to accept an inferior product with major problems that wealthier and more privileged Americans are less likely to accept. I'll show you what I mean, and you can use these next few slides to educate your elected leaders about how AHIP is misleading them. Now, let's first tackle the basis of the AHIP claim. That's the insurance industry lobby. The claim that more minorities that signing up for Medicare Advantage means Medicare Advantage improves health equity. Well, more does not equal better. And that claim is illogical and misleading. Simply stated, more Black people signing up for Medicare Advantage doesn't mean that Medicare Advantage is better for Black people. We saw in the early 2000s that Black people were more likely than other groups to get trapped in subprime mortgages, and these were devastating for Black families and communities. Black people also more often fall prey to predatory payday loans, and it would be ridiculous to conclude that these programs are good for Black people simply because they were disproportionately targeted by them. Those programs did not improve equity, and neither does Medicare Advantage. So what explains the disproportionately higher rates of Medicare Advantage enrollment among Black Americans compared to other groups? Most of this is explained by the lower premiums that are promised in Medicare Advantage. However, these lower premium plans come with hidden consequences. An overwhelming majority of Black Medicare Advantage enrollees choose lower premium plans. And at the same time, Black enrollees are far more likely than whites to be enrolled in inferior plans with lower quality ratings. And Black enrollees also end up far less protected from out-of-control medical costs than white enrollees because they're often enrolled in plans with higher out-of-pocket caps. So how can Medicare Advantage be a solution to inequity? The answer is that it clearly is not. The reality is that people with more financial resources tend to reject the inferior insurance of Medicare Advantage or disadvantage, and many Black enrollees simply don't have that choice. In fact, people in racial minority groups are often steered toward lower quality Medicare Advantage plans in part because higher quality plans are less likely to be marketed or available in the areas where they live. Now let's look at another reason that folks choose Medicare Advantage over traditional Medicare. So while lower premiums are still the main factor driving Black enrollment in Medicare Advantage, for some people like my patient Doris, the driver is the extra benefits. However, when you look closely at Medicare Advantage plans' supplemental benefits, you'll find that these plans often provide little additional value in terms of coverage for services like dental, vision, and hearing. Let's take a look at dental visits, where Medicare Advantage plans save on average only about $23 over traditional Medicare. Now, I should say this is an average across the country, and your union may have negotiated something different if you're in one of these plans. And so this may not mirror your experiences. It's an average. Still, how is it possible that a plan that provides supplemental dental coverage saves only $23 on average over traditional Medicare, which does not provide any dental coverage? Well, the devil here is in the details. If someone has a supplemental dental benefit through their Medicare Advantage plan, but they're limited to a smaller network of dentists, then they may have to see an out-of-network provider where they end up paying out of pocket. They also often have an annual cap on their benefits and are forced to pay high levels of coinsurance for anything but preventive care. And they can also face exclusions and waiting periods that are barriers to receiving dental care, all of which means people pay more out of pocket despite having plans with supplemental benefits. And that is what often happens when people try to use their Medicare Advantage plans to obtain care. It's a very different picture than the ad with the smiling seniors I showed you earlier. And that is where the money is for the Medicare Advantage companies. Routine dental care is covered fairly well, but when patients need care for real problems they're having, that's when the coverage promises fail. And a similar story is evident for vision. Despite the promise of supplemental benefits, the average out-of-pocket cost for accessing vision care in Medicare Advantage ends up being only around $20 less. And a similar pattern plays out with hearing and other Medicare Advantage benefits. So a health plan that's riddled with all of these hidden costs and barriers to care when people really need care causes harm, and that can't be a solution to health inequity. In May of 2024, Physicians for a National Health Program published a report on the negative impacts of Medicare Advantage. And the report shows how corporate health insurers are using all the tactics you see on this slide to maximize their profits while being indifferent to how these tactics harm American seniors. Prior authorizations, narrow provider networks, and other restrictions are some of the key elements that set Medicare Advantage apart from traditional Medicare. And there's more. Here's some data just published in the journal Health Affairs showing that Medicare Advantage plans are more likely to deny claims for Black people than for other groups. See the trend? Medicare Advantage not only perpetuates existing racial inequities in our healthcare system, it worsens them. Now we're going to take a look at how health disparities play out in terms of the medical care people actually receive under Medicare Advantage versus traditional Medicare. Now this chart will show that people from minority groups actually get less health care in Medicare Advantage than white people in Medicare Advantage do. And that is true across primary care, specialty care, flu and pneumococcal vaccines. Really only in the area of colon cancer screenings did Medicare Advantage show a slight advantage for minorities over whites in receiving care. And what about the quality of care to Black people in Medicare Advantage? Remember, the industry's false claim is that Medicare Advantage reduces inequities in healthcare. Now, one proxy for health outcomes is the rate of rehospitalization after surgery. You have surgery in the hospital, and when you recover from surgery, if all goes well, you go home. And then if you have complications that cause you to have to be admitted back to the hospital, well, that's a negative outcome. And when we look at the rates of rehospitalization after surgery, we see a disproportionately high rate of readmission after surgery among Black enrollees. And that's even true in traditional Medicare. You know, Black people often fare worse than white people following surgery throughout our healthcare system because of existing structural inequities. Now, if the health insurance industry claims about Medicare Advantage reducing inequities were true, we'd expect the gap in outcomes after surgery to narrow under Medicare Advantage. Spoiler alert, they don't. What we do see is that under Medicare Advantage, the rates of rehospitalization after surgery for white people is lower than in traditional Medicare. But Black people covered by Medicare Advantage do way worse than white people with Medicare Advantage and worse than Black people with traditional Medicare. So Medicare Advantage actually widens the racial gap in adverse outcomes after surgery between Black and white patients. And finally, let's look at how cost barriers to accessing care under Medicare Advantage are disproportionately worse for Black Medicare Advantage enrollees. In traditional Medicare, Black people are twice as likely as white people to experience cost-related problems accessing care. Compared to traditional Medicare, Medicare Advantage enrollees experience significantly more cost-related problems accessing care. But it's more pronounced in minority populations. Again, rather than solving inequity, Medicare Advantage perpetuates it. Now let's go a step further and let's look closely at people who are considered to be in fair or poor health. These are the people who are accessing the most care because they need it. Now, even in traditional Medicare, this group experiences more cost-related problems than healthier groups, which doesn't say a whole lot about our overall healthcare system. But just look at how much more cost barriers they experience under Medicare Advantage. And the rate of cost-related problems accessing care is dramatically higher among Black people in this group. So the racial differences in cost barriers between Black and white enrollees are really present in both traditional Medicare and Medicare Advantage, and that's indicative of the larger systemic racial inequities in our healthcare system. But the stark differences in cost-related barriers between traditional Medicare and Medicare Advantage tells you all you need to know. Medicare Advantage is not a solution to bringing about health equity, and it's failing people when they need care the most. So when AHIP touts Medicare Advantage as a solution to health inequities in American healthcare, we really need to push back forcefully against this lie because we've got plenty of data to back us up. And here's the truth about what Medicare Advantage actually does. It lures people in with lower premiums and the promise of supplemental benefits, and then limits their choice of providers, adds barriers to care such as prior authorizations, increases their out-of-pocket costs, weakening their financial security. Rather than relieving racial inequities, Medicare Advantage perpetuates them and in many ways exacerbates them. Physicians for a National Health Program is currently conducting research to explore and expose all the ways that Medicare Advantage impacts racial equity in healthcare. And those findings will be released in a new report in the fall of this year. So stay tuned for the PNHP Health Equity Report in September. Thanks everyone for your attention. And it's been such an honor and a pleasure to present to you. And I'm going to turn it back over to Rose.
Wow. I just can't thank you enough, Doctor, for being here and putting that very important racial lens onto this issue. I think it is one that we far too often skip over, and we should not do that. This is critically important information for us to have, and I just cannot thank you enough. There are no more credible voices in the health justice movement than those of you who are at the bedside and providing us with care. Thank you so, so much for being here with us tonight. And now we are going to hear from two people whose lives have been impacted by the greed of insurance companies offering Medicare Advantage plans. Please join me in welcoming James Russell and Megan Brent. Two activists who have been working with one another and with our allies at Be a Hero in the fight to reclaim Medicare. James Russell is an author and an academic who has written 10 books, including The Labor Guide to Retirement Plans for Union Organizers and Employees. And his most recent title was Recovering from Serious Illness Late in Life. Jim's activism began during the civil rights movement, and throughout his career, he has always worked to bring a lens of social activism to his work as a professor. He was a professor of sociology at Eastern Connecticut State University and is now a public policy affiliate scholar at Portland State University in Oregon. Jim also led a campaign in Connecticut to allow union members to switch from 401k retirement plans to defined benefit pensions, and is currently organizing his union siblings to have a choice about their Medicare rather than being forced into a Medicare Advantage plan. As Jim will discuss, he has stage 4 lung cancer, and despite this, like many of us social justice warriors, Jim keeps busy during his retirement and is always in the fight for justice. Megan Brent is a lens-based artist whose work reflects her experience living with a disability. She is currently the Culture Push Disability Arts Curatorial Fellow and has a number of exhibits and projects related to her activism in the fight for healthcare justice. Her work has been exhibited throughout the United States, including the Center for Fine Art Photography in Colorado, the UN headquarters in New York, and the Houston Center for Photography. Like Jim, Megan's father, Gary, was employed by the state of Connecticut as a professor at the University of Connecticut. Jim and Megan's family both endured injustice because of their Medicare Advantage plan, and in response, they met each other through taking collective action and seeking to empower retirees to make their own choices about health care. We will send out links for their to be able to link to their stories. And with that, I am going to go ahead and turn it over to, I believe, Jim, you are going first.
Okay. Thank you very much, Rose. I live in Portland, Oregon now. I retired in 2015 after 29 years of teaching in Connecticut as a state employee. And we had at that time a union negotiated retiree benefit that paid for the costs of traditional Medicare and a supplemental insurance. It was a good, strong benefit. But then in 2018, the state of Connecticut, in order to save money, switched us to a Medicare Advantage plan. They assured us that it was a better insurance plan and that we would be able to see any provider in the country that took traditional Medicare. And that's over 98% of providers. That turned out to be grossly inaccurate, as we will see. In 2021, I had an X-ray that inadvertently turned up a suspicion of lung cancer, even though I had never smoked. So I went to a top-rated hospital, cancer center in Houston, for a diagnostic workup. They said I had a rare form of cancer that strikes non-smokers mostly, and that it was aggressive, and they needed to get to work on it right away if there was any hope. And so their treatment plan was 3 courses of chemotherapy every 3 weeks to be followed by surgery. But then they told me I didn't have to get the chemotherapy in Houston. I could go home, get it in Portland, because they had someone that they worked with who was an oncologist who was a specialist in this type of cancer. I couldn't just go to any oncologist. And so I returned to Portland. I called the hospital where this oncologist was affiliated, and then I was told that they did not take my Aetna Medicare Advantage plan. So I was in a real jam. What do I do? The only thing I could do, because time was of the essence, was to fly back and forth to Houston to get the chemotherapy that I needed. And it wasn't just an issue of expense and convenience that was a problem. This was the height of the COVID pandemic, and I was going through packed airports and flying on packed airplanes when I was immunocompromised from the chemotherapy. And so that was an added form of stress. Fortunately, I didn't get COVID. Okay, I had the surgery. It was thought to be successful. But then last year, the cancer came back. Went back to Houston, got another diagnosis. They said it had metastasized to stage 4. And so now it was a question of controlling it, not of curing it. And the way that they proposed controlling it was to get IV infusions of a targeted therapy every 3 weeks for the rest of my life. And they said, once again, you can get that in Portland if you get it through the oncologist we know so that she can oversee the treatment. So I reminded them that they didn't take my insurance. They then called the oncologist in Portland, and she prevailed over her management to make an exception for my case. And so that's what's happening now. But this is a very imperfect and fragile solution. First off, uh, I am only allowed to see this oncologist and to get the infusions. I'm not allowed to get any other care in the hospital. So when I need an imaging scan, okay, which is a vital part of cancer treatment to keep track of the progress of the cancer, I have to go to another hospital on the other side of town. And there are always coordination problems, between these two. Then should my oncologist in her examination of me turn up a heart problem, uh, she can't just send me to the department that's 2 floors down that has to get an EKG. I have to then go make an appointment at another hospital and get a referral for it. And who knows how long all of that is going to take. Then I am in mortal fear that this arrangement will collapse. Uh, Medicare hospitals are totally free to not take Medicare Advantage plans. They can drop them anytime they want. So if there's a new management team, if there's a new policy, they may decide that they're really going to stick by their guns and not, allow me to be seen there. Um, you know, and if that wasn't enough, my plan in Connecticut is put out to bid every 3 years. So actually, and it'll come up next year. So next year, there may be a different corporate sponsor of my plan, which maybe this hospital will like even less than it likes Aetna. So this is a totally fragile arrangement that I'm involved in. And these are problems I would not have with traditional Medicare because I would just be seen. And I've been told that in the hospital, if only you had Medicare, okay, we could do everything for you. Now, I can assure you at age 80, which I am, it's hard enough to deal with cancer uh, without having to deal with insurance problems on top of that. So what are we doing? As Rose mentioned, I'm involved in a group that's trying to encourage our unions to negotiate uh, a new arrangement with the state so that those people who want Medicare Advantage can have it, and those of us who need traditional Medicare can have it. Um, Now, it turns out Connecticut is one of only 13 states that does not allow its retirees to have a choice between these types of Medicare plans. So thank you very much.
Oh, thank you, Jim. I want to turn it over to Megan now, and to hear her share her story with us, and then I'll share a few more comments. Megan?
Thank you, Rose, and thank you, Jim. As mentioned, my name is Megan Brent, and I'm here to speak about what happened to my father, Gary Brent, and to our family. I want to start by sharing about who he was. My dad was a peace and social justice advocate. He was a volunteer, a teacher, a mentor, an amazing dad. He was my friend and one of my fiercest supporters. For example, when I was 16, I decided I wanted to participate in the Boston to New York AIDS ride, a 250-mile bike ride, and he didn't diminish that goal. He helped me train. I hadn't even ridden a bike since childhood, but every weekend he would drive 20 miles ahead on my training route and wait for me to arrive. He would give me some snacks, refill my water, and then drive another 20 miles and wait for me again, and so on until I was ready to ride. After he passed, I learned from my uncle that they grew up food insecure. And I remember volunteering with my dad at the local soup kitchen for well over a decade. He was there every first Sunday of the month to prepare bag lunches. So he was someone who faced a hardship and then later in his life worked humbly to alleviate hunger in his local community. These examples share a glimpse of the awesome person that he was. He was a Connecticut state retiree who was put onto a Medicare Advantage plan. He didn't choose it. In June of 2022, when he was 81, my father's melanoma returned as a bleeding lesion in his brain. He came out of brain surgery unable to walk, know he had a left side of his body, or even remember that we had visited him. He was in a very fragile state, and our nightmare was only about to get worse. His neurosurgeon unequivocally recommended that he go to a specialty rehab hospital, which had specialists to give him the attention and the care that he needed to recover. And this hospital accepted him as a patient. But insurance, Medicare Advantage, denied the doctor's orders, and Medicare Advantage made my father go to a substandard facility. And even when he was at this facility, they kept trying to discharge him, to kick him out while he was working so hard to recover. In his 49 days at short-term rehab, we experienced 3 attempts to end his care. We appealed 3 times, we won 2 appeals, and we lost the 3rd, and my dad was discharged. I also want to highlight that the 2nd and 3rd denials for his care came only 3 days apart from each other. When he arrived home from the facility, he had a fever and complaints of a headache and neck pain. It turns out he had been discharged with bacterial meningitis. He was then readmitted to the hospital where he remained in critical condition for 3 weeks. He was in isolation. There were times that we weren't sure that he was going to make it through. He did make it through meningitis, but he lost all the gains that he had made in his rehab. Before his meningitis, his oncologist and our family believed that he was getting to the point where he could go back into immunotherapy treatment for his cancer. But after meningitis, we brought him home, and my mom and I took care of him until he passed away. Later, we found out his care denials were because Medicare Advantage is running medical decisions through an AI algorithm, listening to a bot instead of doctors who knew my dad. When he needed his health care the most, Medicare Advantage fought over and over again to do the very least for him. Witnessing my father go through this trauma, living this trauma, opened my eyes to the cruelty of privatized Medicare. I share my father's story to continue to fight for him and to honor his legacy as a social justice advocate. Healthcare is a human right. Denying my dad's care increased profits somewhere, but it took things from us that are invaluable: quality time together, dignity, a chance to return to cancer treatment. There was so much trauma and stress in all our lives from healthcare denials upending everything. And it's a cruel and horrible way to treat someone in the sunset of their life. I speak out because I know this is still happening to many other people. So I'm asking you to speak out with me, with all of us who are here, and to advocate for those who have passed away and deserve better, and for those who are still with us, that they receive the care that they need when they need it. Thank you for having me here tonight.
Jim and Megan, I'm telling you, the cruelty of this system really knows no bounds. Please know that you are the reason why we continue this fight. And we'll never stop until we fix this. Stories are so very important for us to hear because they're not a graph with some dry statistics. They're real people experiencing real effects of a fragmented, complex, and needlessly costly healthcare system. Any one of us at any time could be the victim of this healthcare horror story. Thank you both for your courage to share your stories here with us tonight. Now I'm going to go ahead and switch over and I'm a union organizer, right? And I spent 3 decades in the labor movement. I will eternally be a union organizer, and I would be remiss if I didn't make an ask of you all here tonight. So bear with me for one moment while I bring up the slide. So we've got a couple of different slides I want to show because we have union members here, and we also have some folks that may be with us who are not in a union. So first of all, for the union members here, we need you to pass the level the playing field resolution at your union. Help bring it to a central labor council in your area. Bring it to your state AFL-CIO federation. Help us disperse our briefing paper about Advantage plans. Help educate members of Congress. We need to do this. We're hearing from people on the Hill that, oh, labor loves Medicare Advantage, so therefore we really shouldn't do anything to fix it or to change it. I don't believe that's true. I believe, as I said in my presentation, that labor has been caught between a rock and a hard spot when it comes to this issue because of the cost of healthcare overall that drives us to have to make these kinds of decisions at the bargaining table. We need to take that message to the Hill and say, no, we don't love it. We're stuck because of this system overall. So the first thing you all can do up here on this Hill is level the playing field with legislation that actually makes sure that we are not overpaying privatizers who are not using the money for healthcare, and instead we're using our precious healthcare Medicare dollars to improve traditional Medicare, to make it better, to include more things like hearing, dental, pharmacy, and vision, and to make sure that we can afford it and don't have to buy a gap plan or a supplemental plan because Medicare is an 80-20 plan. We shouldn't have to be trying to figure out how to pay 20% out of our pocket. So we need people to go to their unions and ask the unions that are on the Hill in Washington, D.C. to make sure that our representatives don't think labor loves Medicare Advantage. That there is an unfortunate reality to the cost of healthcare, and that's why we are where we are today. And they need to start doing something to level that playing field, not just us on the outside. And contact, the labor campaign to request an e-board briefing. Bring us in. We're willing to do these presentations. Have us come to do a workshop, maybe at a union meeting, or maybe you have a convention or a conference coming up. Let us know. We want to come in and start talking to union members about the reality of this situation. That's how we're going to grow the movement. We got to organize. It's all about one-on-one relationship building, and a big part of that is education. And affiliate your union with the Labor Campaign for Single Payer for Healthcare, because once labor prioritizes the fight for healthcare as a right, that is when we're going to win. I want you all to know that we're going to be sending an email immediately following this webinar with links to all of the asks to anyone who RSVP'd. So please watch your inbox for that email and be prepared to help to protect and improve traditional Medicare, challenge the abuses of corporate private advantage insurers, and defend Medicaid because lives are literally depending on it. Now, for those of you who may not be in unions, but even those who are, this can apply to literally everybody. Are you with another type of organization? Well, guess what? Working through the Reclaim Medicare Coalescence, we have a letter for the organization to sign on to. It is a letter that highlights the $84 billion in overpayments that private health insurance companies receive by gaming the Medicare Advantage program, which the federal government has allowed to continue for years. The letter requests that instead of cutting essential health programs, Congress address the waste, fraud, and abuse by insurance corporations in the Medicare Advantage program in any piece of healthcare legislation that moves us forward. You could also sign the petition to get members of Congress to help to co-sponsor Medicare for All, the Medicare for All Act of 2025. And you could even join with our partners at People's Action and help phone bank into various states to defend Medicaid. The cuts that are being proposed to Medicaid are going to kill people. I am not being hyperbolic. I am telling you, people are going to die. We have got to do everything we can to be on defense, but we also have to be on offense and offer hope and believe that another world is possible and show people that another world is possible. As I said earlier, this is about bread and butter, kitchen table, working class issues, and there is none more better that drives this economy that could change things dramatically for all of us than moving to a system that guarantees health care for all, no exceptions. With that, I'm going to go ahead and stop sharing again and just offer a few minutes. We're at 8:24, so before we close out, I want to offer a few minutes to take a couple of questions, and I believe Eric has been sort of monitoring the Q&A. So we're only going to get to a couple folks. We're trying to answer them. I think Dr. Weisbart, thank you. My understanding is you have been picking up the slack for us and answering some questions on your own. Thank you for doing that. So we're going to get to what we can because I want to be respectful of people's time. Go ahead.
Thank you, Rose. Thank you, everybody else. The first question, the problem with traditional Medicare is that it generally covers only 80%. That's not a problem with me for routine exams, but if I should ever need surgery, hospital bills can run very high, and I would not be able to pay the other 20%. So I feel like I have to take an Advantage plan. Am I missing something?
Yeah, so there are two different things kind of that are in that question that I want to be really clear about. So traditional Medicare, as you stated, is an 80-20 plan. So that means traditional Medicare pays 80% of the bill and you would pay 20% out of pocket. This was part of the deal back when Medicare was passed in the 1960s. And at that point in time, the medical costs weren't quite what they are today. I really do want to draw everyone's attention to the fact that medical care used to be nonprofit in this country until 1973. You can Google a conversation between President Richard Nixon and Ehrlichman, I think it was, talking about how, for-profit healthcare, I kind of like that idea. So all of a sudden now we see a shift to where healthcare becomes a for-profit industry, and now we see the increase in the skyrocketing of costs. And so the 80-20 plan isn't so good for us anymore. 20% might have been affordable in 1965, not so much in 2025, right? So what people do when they go on traditional Medicare is they buy a Medicare supplemental, or also known as a Medigap plan, to cover that 20%. Okay, so you're paying for the Medicare premium, the traditional Medicare premium, and you're also paying out of pocket for a premium for this Medigap or supplemental plan. This is where we're saying we know that Medicare is flawed. That's why we say we want an improved Medicare for all. We would like to take some of this money that is going to these overpayments, and potentially we could make it a 90-10 plan or a 95-5 plan, or even better yet, a 100% plan. At the very least, put a maximum out of pocket for seniors. If they choose to take traditional Medicare, and if they end up having to buy a gap plan, it would be for a much smaller portion, and therefore should be a much smaller out-of-pocket cost even for the premium. Now, that is different than Medicare Advantage. Medicare Advantage is not traditional Medicare, and there is not an 80/20, and there is not a gap plan that you purchase for it. Medicare Advantage is just like the types of insurance plans we had when we were in the workforce. For any retirees out there, for any active union members and active workers, that's part of the deal when you're an employee, right? The employer provides an insurance plan. It's no different. That's why we see this as problematic, because that is how they are privatizing our Medicare fund, is just shipping off a bunch of cash and saying, you plans go take care of these retirees. But the plans, of course, operate on a for-profit margin. So they're going to do things to take more money in than they pay out. And that means there's going to be denials of care and less care provided to the patients. So it is a hard choice for retirees. I understand that, but I am telling you, if you are able to afford a Medigap or a supplemental plan, which is going to cost more than Medicare Advantage does at this time, it is. But if you can eke that out, you will be better off in the long run. No different than when we're at the table trying to figure out, do we put more money into the premium on the front end, and not have high deductibles and co-payments on the back end? Or do we have a lower premium and then end up hoping we don't get sick and get socked with a $15,000, $20,000, $30,000 hospital bill on the back end? It's always a crapshoot and a risk. But for retirees, we're using more healthcare than we did when we were younger. It's much better to have traditional Medicare with a gap plan if you can afford to do it. Hopefully that answers that question.
Thank you. We really only have about one more minute for this.
Okay.
The question was about the threatened privatization of the Veterans Administration, and how does that connect with the privatization of healthcare?
Thanks, Eric. I really would say this. I mean, it's all connected, right? It's all connected to that very term, privatization, as we are seeing, more and more resources robbed from our veterans and from the Veterans Affairs, administration. We are seeing the same thing happening as we get robbed out of Medicare by these privatizers who are putting profits over patients. We cannot allow the VA to be privatized. This will not be good for our veterans. We need to take care of our veterans. If we truly support the troops, we need to mean it. And that means we need to protect the VA and make sure that they have all of the necessary resources to take care of the veteran population. So it's a connection because it's privatization. We're going to try to see if we can take any unanswered questions, and perhaps down the line we could provide answers to some of them in follow-up to you all. But I want to, again, be respectful of time, so I'm going to go ahead and just share my last screen here and say to you again that you're going to be receiving an email following the webinar with links to the ASS and all of the documents we've been talking about, including the presentations. So please feel free, if you'd like, to get in touch with us at organizers@laborforsinglepayer.org. If you have any further questions or want to have us come out and do presentations. Thank you all so much for attending. We hope you found the information provided to be of interest and useful. The stalwart labor leader, A. Philip Randolph, said, "The essence of trade unionism is social uplift. The labor movement has been the haven for the dispossessed, the despised, the neglected, the downtrodden, the poor. As trade unionists, we must never forget that. And may we be the agents of social uplift in these troubling times by uplifting guaranteed health care for all, no exceptions." Wishing you all a very happy Juneteenth. Si se puede, everyone. Good night.